Have you ever wondered why some nursing theories seem to work better than others in the ICU? Or why understanding behavioral systems can dramatically improve patient outcomes during critical illness? Well, in this video, I'm going to walk you through Johnson's behavioral system model step by step, showing you exactly how to apply it in your critical care practice. Welcome back to another video lesson. My name is Neil and this is NurseBrain, where we break down complex nursing topics and make them easy to understand. Today, we're going to dive into Dorothy Johnson's behavioral system model, a nursing theory that has significant application in critical care settings. Before we begin, if you find this video helpful, please hit that like button and subscribe to the channel. Make sure to hit that bell icon and select all notifications so you never miss out on our new lessons. Let's get started. Background of Dorothea Johnson. Dorothea E. Johnson was born in 1919 in Savannah, Georgia. She received her nursing education at Vanderbilt University. Graduating in 1942 as the top student in her class, she later earned her master's in public health from Harvard University in 1948. Johnson spent most of her career teaching at the University of California, Los Angeles from 1949 until her retirement in 1970. During her career, she developed what we know as behavioral system model, which she first proposed in 1968 and later refined in 1980. What's interesting about Johnson's theory is that it was heavily influenced by Florence Nightingale's work. Johnson believed, like Nightingale, that nursing goal is to help individuals prevent or recover from diseases or injury by focusing on the patient as an individual rather than on specific disease. Here are the core concepts of the behavioral system model. Johnson's behavioral system model views humans as having two major systems. One, the biological system, which is the focus of medicine. Two, the behavioral system, which is the focus of nursing. According to Johnson, each individual has patterned, purposeful, repetitive ways of acting that comprise a behavioral system specific to that individual. The model defines nursing as an external regulatory force which acts to preserve the organization and integration of the patient's behaviors at an optimum level under those conditions in which the behavior constitutes a threat to the physical or social health, or in which illness is found. In simpler terms, the patient's behavioral system is out of balance due to illness or stress. Nursing's role is to help restore that balance. Here are the 7 subsystems. Johnson identifies 7 behavioral subsystems that make up the complete behavioral system. Let me break this down to you. Number 1. Attachment or affiliative subsystem. This involves social inclusion, intimacy, and formation of strong social bonds. In critical or survival and security, in the ICU, the patients are often separated from their support system, which can disrupt this subsystem. Dependency subsystem. This promotes helping behavior that calls for a nurturing response. In critical care, patients often become highly dependent, which can be challenging for those who were previously independent. Ingestive subsystem. This relates to when, how, what, and how much we eat. In the ICU, this subsystem is frequently comprised by NPO status, tube feedings, or altered appetite due to medications. Eliminative subsystem. This concerns when, how, and under what conditions we eliminate waste. Catheterization, bowel management, and other interventions in the ICU directly impact this subsystem. Sexual subsystem. This encompasses both biological and social factors affecting sexual behavior. This is often overlooked in critical care. This subsystem remains part of the patient's identity. Aggressive protective subsystem. This relates to protection and self-preservation. In the ICU, patients may delay defensive behaviors when they feel threatened or vulnerable. Achievement subsystem. This involves behaviors aimed at controlling or mastering aspects of self or environment. ICU patients often struggle with loss of control, directly affecting this subsystem. Each subsystem has three functional requirements: protection from noxious influences, provision for a nurturing environment, and stimulation for growth. When these requirements aren't met, the subsystem becomes imbalanced, leading to disequilibrium in the entire behavioral system. Application in critical care nursing. So here's the question. So how do we apply Johnson's model in the ICU? Let's walk through a practical example. Imagine you have a 67-year-old male patient admitted after a CVA. He represents with right-sided weakness, expressive aphasia, and slurred speech. Using Johnson's model, you would assess each subsystem. Attachment. How is his connection with family and friends affected by hospitalization? Dependency. How is he adapting to physical and financial dependence on others? Ingestive. Is he experiencing decreased appetites or difficulty swallowing? Eliminative. Can he walk to the bathroom or is he requiring assistance? Aggressive protective. Is he worried about his condition or expressing concern about his wife? Achievement. How is he coping with the need to relearn, like walking, talking, and activities of daily living? Based on this assessment, you might identify nursing diagnoses such as insufficient development of the affiliative subsystem, insufficient development of dependency subsystem. Your intervention would then focus on providing external regulatory forces that protect, stimulate, and nurture the behavior system. This might include the following: explaining procedures and teaching both the patient and family, providing opportunities for the patient to maintain connections with loved ones, gradually increasing independence and activities as appropriate, monitoring and supporting nutritional intake. The goal is to help the patient maintain and restore equilibrium in all subsystems. Strengths and limitations of the model. Johnson's behavioral system model has several strengths that make it valuable in critical care. It's logical and the concepts are interrelated. It's relatively simple to understand and apply. It has a significant impact on nursing practice by focusing on the whole person. However, there are some limitations to be aware of. It was primarily developed for hospitalized patients, which works well in the ICU but may be less applicable in other settings. The definitions of some concepts are abstract and can be difficult to apply. It can be challenging to use with physically impaired individuals. It's very individually oriented, making it difficult to apply to groups. Dorothy Johnson's behavioral system model provides a valuable framework for understanding and addressing the behavior aspects of patients' care in critical settings. By viewing patients as behavioral systems with 7 interconnected subsystems, we can better identify imbalances and implement interventions to restore equilibrium. Remember, the goal of nursing, according to Johnson, is to help patients maintain behavioral system balance even during illness or stress. By applying this model in your practice, you can provide more holistic care that addresses not just the physical aspects of illness, but also the behavioral responses to it. If you found this video helpful, please give it a thumbs up and share it with your colleagues. Don't forget to subscribe to our channel for more critical care content. In our next video, we'll be discussing more nursing theories and their theorists. Until then, thank you for watching, and I'll see you in the next lesson.